अब ना अगर डेस्परेट केसेस हैं, हु इज सफरिंग फ्रॉम सुसाइडल टेंडेंसीज, उसमें अगर हम काउंसलिंग करेंगे, यू नेवर नो बाय द टाइम काउंसलिंग की जो इफेक्ट आएगा, उससे पहले कहीं कोई ऐसी प्रेसिपिटेटिंग इवेंट ना हो जाए कि वो सुसाइड कर दे। तो ये कुछ डायकोटमीज हैं, वो अपनी तरीके से ही हम उसको ट्रीट करते हैं।
डॉक्टर साहब, मेरी सोच ये है कि ओवर एक्सपेक्टेशंस अपने से भी और दूसरे से भी, इससे बचना होगा। अगर सब, एक बात पहले ये जानना चाहता हूँ कि आप डॉक्टर भी हैं, कर्नल भी हैं। आप कर्नल पहले लिखते हैं और डॉक्टर ब्रैकेट में लिखते हैं। मुझे लगता यह है कि डॉक्टर कहना ज़्यादा सम्मानित है और कर्नल कहना उससे कम सम्मानित तो नहीं है। इसके बारे में कुछ विरोधाभास लगता है, तो इसको थोड़ा सा क्लैरिफाई करते हैं। जी
ऐसा है, मैं सुना है कि अब ये डिलेमा है।
जी
आई एम प्राउड टू बी बोथ, यू नो, senior army officer of the Indian Army, which is held in very high esteem amongst the society, and at the same time a doctor. So it's very difficult for me to choose कि पहले क्या लिखा जाए, colonel or doctor. When I'm doing private practice, I always write doctor and colonel is in bracket. But as an individual, I feel more pride in being a senior army officer, which represents discipline, punctuality, no nonsense man at the same time. दूसरी तरफ आता है हमारा मेडिकल का, where one has to be very compassionate, very patient, and down to earth, should be able to relate with the patient's feelings, reassure him that he's going to be all right, guide him properly. And if he was suffering from psychological problems, counsel them. I give counseling to these people. Money doesn't matter. I give more than half an hour to each patient.
डॉक्टर साहब, सो नाइस ऑफ यू। मैं आपको बहुत ही साधुवाद और धन्यवाद देना चाहता हूँ, मगर कुछ अपनी चिंता इस सब्जेक्ट पर जिसने आपसे यहाँ चर्चा की। मेरी सोच ये है कि चिंता करना ही चिता का मार्ग तक पहुंचाती है। हम लोग कुछ समय के लिए पृथ्वी पे आते हैं। हर चीज को, हर स्पेशली दुख को एक चैलेंज की तरह से लेना चाहिए। हर आदमी को एक डॉक्टर की तरह से सोच रखनी चाहिए कि जो भी मेरी डिफिशियंसी है, जो भी चैलेंजेस आ रहे हैं, आई एम द बेस्ट डॉक्टर, और उस तरह से ट्रीट करने की कोशिश करनी चाहिए। नीड ऑफ द आवर यही है हर एक की ज़िंदगी में। मेरी सोच ये है, इफ समथिंग कैन नॉट बी क्योर्ड, इट शुड बी एंड्योर्ड। तो डॉक्टर साहब, मेरा सोच ये है कि काउंसलिंग इज़ द बेस्ट वे आउट। और आप बहुत अच्छी काउंसलिंग करते हैं, ये जान के मुझे बहुत प्रसन्नता होती है, क्योंकि दैट इज़ द बेस्ट सोशल सर्विस। आज के ज़माने में आदमी बहुत जल्दी इंसल्टेड और ह्यूमिलेटेड महसूस करता है। मुझे लगता है जब हम एंगर थर्मामीटर की बात करते हैं, तो हम सोचते हैं कि एंकर होने का एक थर्मामीटर होना चाहिए 0 से 100 तक। मान लीजिए कोई चीज़ रिवोकेबल है, तो आप गुस्सा कर लीजिए, मगर आपको गुस्सा करने से कुछ मिलने वाला ही नहीं है, तो अपनी रिलेशनशिप किसी से बिगाड़ने से क्या फ़ायदा। और जनरली बॉसेस से भी प्रॉब्लम हो जाती है इसी तरह की। और बॉस जब नाराज हो जाते हैं तो वर्कर की इफिशिएंसी भी डाउन होती है। तो कोई भी स्थिति हो, मेरा कहना यह है कि सबसे बड़ी ट्रेजेडी तो किसी की डिमाइस का दुख होती है, और फिर यह है कि फिजिकल हैंडीकैप्ड और चोट होने का भी होता है। और बाकी सब चीज़ें जो आपने बताई हैं वो तो छोटी मोटी हैं, उसके बारे में तो बिल्कुल चिंता नहीं करनी चाहिए। 3 मिनट का समय
जी,
आप थोड़ा सा हमारे उन साथियों को काउंसिल करने की कोशिश करिए, जिससे कि उनका उत्साह बढ़े और डिप्रेशन का नामो निशान ही इस जिंदगी से हर व्यक्ति हटा सके, तो इससे अच्छी कोई बात नहीं हो सकती।
नहीं, बस हमारी कंट्रडिक्शन दो चीजों में भी रहती है
जी
कि एक तो मालूम है कि ये जो काउंसलिंग है, दिस विल टेक अ वेरी वेरी लॉन्ग टाइम, इट विल रिक्वायर्स लॉट ऑफ सेशंस।
जी जी जी।
दूसरा है कि पेशेंट रिसेप्टेबल है या नहीं। बहुत अगर रिसेप्टेबल नहीं है, हॉस्टाइल है, तो उसको काउंसलिंग में बहुत देर लगती है, उसका फायदा नहीं होता है। तो इसीलिए हम दोनों काम करते हैं, हम मेडिसिन भी शुरू कर देते हैं और साथ में काउंसलिंग भी देते हैं। सो दिस इज वन ऑफ द पॉइंट, मेन पॉइंट ऑफ डिफरेंस बिटवीन मी एंड माय बेटर हाफ हु इज एन एक्सपर्ट इन साइकोलॉजी। सो यही हमारा जो कंट्राडिक्टरी पॉइंट्स हैं, जैसे कहता है ना कि वी हैव टू हैव एन एडजस्टमेंट इन मैरिड लाइफ, सो वी रिस्पेक्ट ईच अदर्स प्रोफेशन
तो डॉक्टर साहब एक बात और
और
पूछनी
डू
थी
नॉट।
कि काउंसलिंग से तो फायदा होता है निश्चित रूप से, और दवाइयों से भी निश्चित रूप से फायदा होता होगा, मगर दवाई ज्यादा बेटर है कि काउंसलिंग ज्यादा बेटर है? और इसके बारे में कुछ बताइए आप।
और ये तो मैं आपसे कन्फेस जरूर करूंगा कि काउंसलिंग इज मच बेटर देन दवाई, बट उसमें मैं उसको दूसरी तरह से देखता हूँ। जब हम दवाई देते हैं तो दवाई से माइंड को हम काम कर देते हैं, तो माइंड जो है start becoming at peace, comes at peace. So once the mind starts coming at peace, the person starts feeling, you know, good senses. Then he develops little amount of confidence, and he says, "Yes, of course, the medicine has worked. So he's a good doctor. Now let me listen to him." तो तब जाके वो काउंसलिंग के एक शॉर्ट वो हो जाता है, कोर्स हो जाता है। तो ये मेरा सोचने का है।
आप अपना सेशन
Okay.
स्टार्ट करिए। जी।
Okay. So, what are the various types of events or situations which are known as stressors? Or we can say, what are the types of stressors? So, there are five main types of stresses basically. So, the first one is called acute stress, which involves brief focal events that sometimes continue to be experienced as overwhelming well after the event has ended. Let us see the examples also. So let us see. So the example is like breaking your leg. So once you meet with an accident, break your leg, for say 48 hours, you are totally shocked, you're stressed out. But subsequently, you get used to it. When you start thinking of what's going to happen in future, do you know that your leg is going to be all right, and sooner or later you'll be back on your feet again. Though you may continue to feel, okay, what's going to happen to my job? But if you take it positively, you can say that this is a good time to relax, which was not possible had you been on duty. So the next one is chronic stress that includes events that persist over an extended period of time. So the chronic stresses are like, um, again, so let us give me a, say like caring of a patient or parent with dementia or any other chronic problems, say kidney failure or terminal case of heart disease. So this is a chronic stressor. You keep on passing through chronic stress. Then long-term unemployment. You lose your job, and then it takes a long time for you to find another job. So there's a job insecurity, the financial problems come up, along with many other problems, as you can anticipate. Imprisonment is again one of the chronic stress. They do not know what's going to happen to him once he gets released, and whether he's going to be getting a job or not. So there'll be a permanent label on his character. Then is exposure to military combat, what is known as so these are traumatic events in which a person is exposed to actual or threatened death or serious injury. So the examples I'd like to give you, such as exposure to military combat, and many succumb and they get martyred as a result of military operations, either by terrorists or by the enemy. Physical attacks. These are also, instances which cause chronic stress. Then sexual assault. Childhood abuse. We can imagine a child whose mind or psyche has been affected, and they'll continue to live in guilt throughout their lives. Terrorist attacks, where lots of people die. Whatever happens to their families, you can imagine. They pass through great stress for a long, long time. They may have, and life may entirely change. Natural calamities. When a person loses his entire earnings, he loses his house, he loses his all belongings, he doesn't have money with him. So where will he locate? So this will continue to have long-term effects on him. Automobile accidents, which lead to, most of them may lead to permanent disabilities. Then the next one is significant life changes. These are events or situations that require us to make changes in our lives. You're living a comfortable life, very contented life, and all of a sudden, a situation occurs where you have to change your life completely. Your lifestyle changes. So let us see the examples. See death of a close member, family member, with whom you have a very strong emotional bond. All of a sudden, a person may lose his or her spouse. Suddenly, the life changes, and they will be living in a traumatic condition for most of the time. Marriage. Boy and a girl gets married. Before marriage, they had their own lifestyle, their own circle of friends, and their own habits. Now, once they come in bond, their life changes. They have to make adjustments. There may be some conditions in which they do not like to make adjustments, or they do not, have unanimity on certain adjustments that they are supposed to make. So their entire lifestyle changes. Divorce. So it's a very traumatic incidents which happens in a lot of families, where the entire family gets shattered. That if they are children, they may be, handed over to custody may be given to either of the parents. So the children are the main sufferers, apart from the affected parties. Yes, of course. Then moving out to a different place. So here here's a quote that there are always a sadness about packing. I guess you wonder if where you are going is as good as where you have been. I have, while being in the army, moved out almost 9 to 10 times. And from a different culture to another, absolutely another culture, where I did not know anyone. But still, over a period of time, we settled down once again, developed our own social circle, friends. And by the time we started living together, comfortably, we had another episode of stay. So you can say that every new beginning comes from some other beginnings end. The next is daily hassles. This is the commonest type of stressor that we have in our lives. And it irritates you quite often. Say, for example, rush hour traffic. When you commute to your working place, you are stuck up in the traffic rush. In a place like Mumbai and Delhi, where there are metros, moving around in a metro is again a tall order. Argument with family. So this argument may turn sour. People may not speak to each other. The couple may not speak to each other for a couple of days. Their moods remain upset. They may not be able to concentrate in their respective works, and gradually they come back. So, but if the arguments continue again, that is going to lead to obvious consequences. So, then argument with the friend. You have a close friend, but you have an argument, and for some time, both of you will remain upset. But after some time, yes, there's a reconciliation, and you can come back. These are happenings in daily life. Then annoying workers. Say, for example, your colleague is a relative of your boss. He will try to needle you as much as possible and distract you from doing his job. So this is also a type of stress. He may go and tell his relative, look, so-and-so is not working well. His performance is poor. Most of the time, he spreads lies, which can affect the career of that poor gentleman. So annoying co-workers, lost keys. You've gone to the market, parked your vehicle, and when you come back after shopping, you find that the keys have been lost, the car keys have been lost. And that keychain also have the house key. So these are such, common incidents which happen in our daily lives. So we have discussed these daily hassles. Now comes the important topic of fear of missing out. I would like to elaborate upon daily hassles a little more. Say, these are minor irritations and annoyances that are part of our daily lives. They can build up on one another and leave us just as stressed as life changes events. Eventually, daily hassles can add up and take a toll on us both emotionally and physically. Thus, there is one important observation that the frequency of daily hassles was found to be more strongly associated with physical health problems. than were life change events. And daily minor hassles, especially interpersonal conflicts, often may lead to negative and distressed mood states, basically. So I've already, I'm just talking about daily lives. I forgot to mention that, the cyber hassles that occur on social media may represent a new source of stress. And this is a matter of great concern nowadays. See, FOMO, as I discussed, is fear of missing out. The greater Facebook or social media induced stress, say, for example, guilt or discomfort over rejecting friend requests, and anger or sadness over being unfriended by another. So these are the, stressful situations with the younger generation, Gen Z, I would say, not X now. They have, progressed to Gen Z, they are facing. And this is one of the, problem of great concern in our country. So now let us come to the actual topic of fear of missing out. So what is FOMO? It's known as FOMO. See, fear of missing out is a phenomena observed on networking sites that refers to a feeling or perception that the other individuals are having more fun, pleasure experiences, living more desirable, satisfactory, effect lives, or experiencing better things as compared to the person. See, in recent years, as you're aware, social media has reshaped the individuals interact. On the one hand, it provided us new means to develop relationships and remain socially connected, and has facilitated more reciprocal and continuous interactions amongst individuals regardless of time and location. Then, so you can always say that FOMO, or fear of missing out, is a type of internet addiction that predominantly affects children and adolescents. And it is characterized by the desire to stay continually connected with what others are doing. And characteristically, individuals experiencing FOMO are driven to keep up with others and what they are doing. And this drive results into their social behaviors. Now there are, it includes two perceptions basically. So it includes two processes. First is the perception of missing out and the compulsive behavior to maintain these social conditions. And an unfulfilled social needs result in a negative emotional state. So let us see, when they are in a negative emotional state, our children, young adults, they develop, they indulge in drug abuses, alcohol and tobacco abuse. And what are the reasons behind them, which drive them into adopting bad habits? So the commonest two causes are that they want to feel good about themselves or forget the pain, or they take up drugs just because they're friends, or youth icon, or any, say, celebrity, film celebrity, they idolize, they endorse drugs or alcohol or smoking. And the commonest substance abuse amongst adults is tobacco and alcohol, inhalers and cannabis. So it has been seen that students who experience higher levels of FOMO are less motivated to learn, and they are more likely to engage in social media use in their classrooms also. They do not, pay attention to the lectures, but they engage in social media. This is very unfortunate. And studies have also established that there's an association between the higher levels of FOMO with sleep disturbances, anxiety, depression, and decline in academic performance. So further then comes your personality types. See, there are two types of personalities. First is type A and type B. Type A personality, the people who have type A personality, they tend to be intensely driven workaholics who are preoccupied with deadlines and always seem to be in a great rush. Their aggressive and chronic struggle to achieve more and more in less and less time. So an excessive competitive drive, chronic sense of time urgency, impatience, hostility towards others, particularly those who get in the person's way. They often go to bed late at night. They're quick-tempered, and they often become noticeably agitated when dealing with those co-workers he feels work too slowly or whose work does not meet his standards. They typically react with hostility when interrupted at work. And they experience problems in his marriage over his lack of time spent with family. Type B personality is very simple. It's those who are more relaxed and laid out. And it's been seen that heart disease is more than 7 times more frequent among type A's as compared to type B's. So type A personality, they have a lot of medical conditions and shortened lives. So what are the effects of chronic stress? Let's see. It's frequent infections. As I said, whenever you have chronic stress, your steroid levels remain high, continuously high, and steroids, they suppress your immunity. So once the immunity is suppressed, you become more susceptible to infections like common cold, asthma, bacterial infections, backaches and body aches, eczema, headaches, tension headaches, migraines. Then hypertension. This is due to both adrenaline and steroids, which are known to produce or create hypertension, heart disease, and heart attacks as a result of these hormones, as well as high blood pressure. Diabetes. This is mainly due to steroids, what is known as stress diabetes, steroid-induced diabetes. Can have paralytic strokes as a result of high blood pressure, hypertension, and narrowed vessels. Then drug abuse. So once a person goes for drug abuse, his life is ruined. Then drug, alcohol, and tobacco addictions, mental depressions, and curtailed lifespan. It's been seen, This is the chromosome which have caps on both sides, both ends. So these caps are known as telomeres. Because of chronic stress, these telomeres, the height is reduced, they become short. And the shorter they become, the more curtailed becomes the life. Then they develop suicidal tendencies or even commit suicide. Insomnia, wakefulness, lack of sleep, then anger, irritability, short-temperedness, as we have just described. So now the next, effect of traumatic events, is post-traumatic stress disorder. Now this is very common. You must have heard a condition called Gulf syndrome, where the US Army was there in Iraq for several years. And when they came back, most of the soldiers and officers, they were suffering from post-traumatic stress disorder. They have painful memories of the stressor event, that is the war. Persistent negative emotional states. They remain detached from others. They develop angry outbursts, and they try to avoid anyone reminding them of those unfortunate events. They feel guilty that somebody has given up his life to save me, or that I was ordered along with other people to shoot at innocent people. We have killed a lot of innocent people, and for what? What was the aim of this war? It was only political and geopolitical in nature. So these are the post-traumatic stress disorders which they have passed. Lots of soldiers have. I don't have the exact statistics. Before this, yes, of course, I have something called, no, I think there has been some, yes. I think I missed out on this one. Okay. There is something wrong with my slides, but there was one condition called job burnout, which I wanted to speak upon at length. So without the slide, I'd like to go ahead. No, I think there's something wrong over here. Yes, job burnout, let us see. Say some people who are exposed to chronically stressful work conditions, they can experience job burnout, which is a general sense of emotional exhaustion and pessimism in relation to one's job. Say, for example, a clerk, throughout his life, he keeps on working doing the same job, and he gets stressed out. He is fed up with his job. Say, for other conditions, like examples are social workers, teachers, doctors, police officers, apart from clerks, of course. So job burnout is often precipitated by feelings of having invested considerable energy, effort, and time into one's work conditions while receiving little in return. So as I've just said, now job burnout consists of 3 dimensions. First is exhaustion. See, the exhaustion is a sense that one's emotional resources are drained, and that one is at the end of his rope and there's nothing more to give at a psychological level. Then comes depersonalization. And depersonalization is the sense of emotional detachment between the worker and the recipients of his services. In other words, he is not bothered about his clients, he's not bothered about his workers, subordinates. This often results in callous, cynical, or indifferent attitude towards these individuals. And third is diminished personal accomplishment, which is the tendency to evaluate one's work negatively by, for example, experiencing dissatisfaction with one's job-related accomplishments or feeling as though one has categorically failed to influence others' lives through one's work. So, this is part of the job burnout only. We have already discussed, and this is most commonly observed in workers who are older, that is between the age groups of 55 and 64. This is the time when you're just on the verge of retirement, and immediately after retirement, unmarried people, then those jobs which involve manual labor, and job burnout is associated with heavy alcohol consumption, physical inactivity, being overweight, lifetime mental disorders, and depression. Thank you. This is all I had to speak about mental stress disorders. And at this point of time, I would like to, express my deep gratitude to two persons who have contributed their inputs. One is the writer of the book on psychology, and second is my wife, Dr. Mrs. Kamila Paruthi, who is an expert expert psychologist, has more than 20 books publication to her credit, with more than hundreds of papers which have been presented in or published in national and international journals. She is a general fellow, that is, she has done a postdoctoral, and who has given me valuable inputs because this is her topic and she's an expert of it. So she has given me valuable inputs in creating this presentation. So thank you very much.
डॉक्टर साहब बहुत बहुत धन्यवाद आपका। आप बहुत मेहनत से और अपनी स्लाइड्स को तैयार किए और इतना कठिन सब्जेक्ट को इतने सरल तरीके से आपने पेश किया।